All right, hi again, welcome. We are now hanging out with Group 5, and they're going to be presenting for us. It's a Saturday night, and nothing that people would rather be doing than hanging out with their instructor on a Saturday evening. So here we are, and I'll just go ahead and turn the time over to you ladies.
Okay, awesome. So we are presenting on the professional member for the organizations in healthcare industry. So if we could go to the next slide. So healthcare professional organizations, basically it's just members within the community get together, and it's an opportunity for them to boost their credentials and get to know more career opportunities that are available, including advancements in careers. And what a lot of the organizations do is they have the chapters divided by local regions and areas, and they're all run by regents, which are elected by the local members to help sponsor the events and to get things going to help people become informed. Also within all of the professional organizations are the advocacy services, which are just different levels of that within the professional organizations. So the next slide.
Okay, so that's me now. So the healthcare industry encompasses many professions, and you'll find a professional organization for most of them, and sometimes even more than one. And today we'll be talking about the following professional organizations for these careers. The first one is healthcare administrators. The second one is healthcare financial managers, physicians, ambulatory surgery center administrators, and medical group practice administrators. Next slide, please. Okay, so the first is the American Association of Healthcare Administrative Management, and they represent the healthcare administrators. And this company was founded in 1962. The second one is Healthcare Financial Management Association, and they represent healthcare financial managers. And they were founded in 1946, and they have more than 40,000 members. The third one is American College of Physicians, and they represent physicians. They were founded in 1915, and there are more than 148,000 members. The fourth one is Ambulatory Surgery Center Association, and they represent ambulatory surgery center administrators. They were founded in 1970, and they're the national membership association that represent ambulatory surgery centers. And the last one is the Medical Group Management Association. And they represent the medical group practice administrators, and they were founded in 1926, and they represent more than 33,000 administrators. So those are the ones that I picked, but like I said at the beginning, there are more than one. So these are just the ones that I found. And next slide, please.
Okay, so I'm going to be going over the benefits of being a member of each of these organizations. And so for the American Association of Healthcare Administrative Management, they represent the interests of healthcare administration. A lot of the benefits for all these groups are kind of the same, but I'll go over them in more detail. For this, the benefits include education, reduced pricing to the annual National Institute, networking, getting involved with your local chapters, and getting to know others in the same position as you in your community. Another benefit is certification to help you in your career, and advocacy gives you a voice in Washington, D.C. on legislative issues that can affect your industry. There's a discount program that has exclusive discounts on products and services, and publications, meaning free subscriptions to different publications that can boost your knowledge. Next slide. For the Healthcare Financial Management Association, they help build coalitions with other healthcare associations to achieve consensus on solutions for the challenges that all of the U.S. healthcare systems face. And so their benefits include subscriptions to the #1 publication among healthcare CFOs and chapter membership as well to meet colleagues and connect in your local area. Also discounts on all products and services, and also certification programs that enhance your skills and can build your career by receiving certification. And next slide. The American College of Physicians, they're a national organization of physicians who want to help provide quality care to patients through gaining more knowledge and expertise in their specific areas. And their benefits also include education. They have lots of resources to keep their knowledge updated. They can take courses, watch recordings of them, and they also can have clinical support, subscription to peer-reviewed medical journals, and they have practice resources, so if they own their own practice, resources to help improve that and tools to implement change. And in the community, they also have the opportunity to join a network of peers who share their vision, and they get to meet other physicians in their community. Next slide. The Ambulatory Surgery Center Association. So an ambulatory surgery center is, for those who don't know, just a surgery center that usually performs one-day or surgeries where you don't have to stay overnight. So it's an acute care facility. And so this association represents the ambulatory surgery centers and provides advocacy and resources to assist them in delivering high quality and cost-effective surgery to all the patients that they serve. And so they also receive education for being a member of this association. They have meetings and seminars, and also some seminars over the web to provide tools and resources. They provide information to stay on top of legislative developments and make sure they're up to date with regulations. They have resources, many tools to help them with growth and productivity and networking. They can also meet local peers and online as well to meet colleagues from all across the country to help them in their careers. Next slide. So the last one is the Medical Group Management Association, and they provide the essential education, legislative information, and career resources to the medical practice leaders to help improve patient services and efficiency. So all of these associations' main goal is to better patient care, and their benefits include education, seminars as well, and webinars, and special conferences that they can attend that they're invited to increase their knowledge. And they also have certification programs, and they're eligible for the Certified Medical Practice Executive Program. And they're also eligible for earning fellow status, which is a prestigious mark of distinction and the highest level that you can achieve in a medical practice. And they also have the opportunity to represent their team's interests and concerns in Washington, D.C. So those are all of the benefits for being members of these associations. Next slide.
Okay, sorry, let me just chime in real quick. This is just the funniest picture I've seen in a long time. That's what I have to say. That's it. I don't want to throw you off, but that picture was funny to me.
Okay, it's my turn. Trade associations. Who is HACA? The Healthcare Supply Chain Association represents the nation's leading healthcare group purchasing organization, the GPOs, which are critical cost savings partner to American hospitals, nursing homes, nursing home-made pharmacies, clinics, home healthcare providers, and surgery centers. HC HSCA and its member GPOs are committed to delivering the best products at the best value to healthcare providers, increasing competition and innovation in the market, and to be supply chain leaders in transparency and accountability. Other trade association, HISCA, Healthcare Group Purchasing Industry Initiative. Next slide. What is a GPO? A group purchasing organization. It's an entity that helps healthcare providers, such as hospitals, nursing homes, and home health agencies, realize savings and efficiencies by gathering purchasing volume and using that leverage to negotiate discounts with manufacturers, distributors, vendors. GPO member ambition: reduce healthcare costs, support competition and innovation, support transparency, and improve healthcare supply chain. Next slide. In this image, we can see the value of the group purchasing, the organization GPO to U.S. healthcare system. It's going to cost saving to the U.S. healthcare system in 2012. After that, it's cost saving in Medicare 2015 to 2022, and cost saving to the U.S. healthcare system 2013 and 2022. Okay, next slide. Okay, I'm gonna talk a little about the history of the HSCA. The association was founded in 1990 as the Health Industry Group Purchasing Association. In 2007, the supplier community of HSCA became an independent association called the Health Industry Supply Chain Institute. After that, the HSCA continues to work collaboratively with HISCI, hosting events and education. In 2011, HAGPA was renamed as the Healthcare Supply Chain Association to better align the organization name with his mission to provide advocacy and education to those involved in the healthcare supply chain. And the HSCA celebrates its 25th anniversary in 2015. Next slide. Okay, the membership requirements is exclusively for group purchasing organization. Applicants must complete a membership application for consideration. Approved companies must pay annual membership dues and participate in the healthcare group purchasing industry initiative. And I think that'll be all.
Sorry, did you say that was it? Was that the end?
Yes.
Okay. No references then? No. Okay, that's okay. All right, we'll just end on this slide here for a couple questions because again, I like the picture. So I guess for the first question for you all, if anyone would like to chime in, you're more than welcome to do so. First of all, I'm curious why any one of you or all of you chose this particular topic to present on.
I guess for me, I just, I didn't really know much about this. I've said before that my dad is a healthcare administrator, and so I was just curious as to these associations because I've heard him talk about them before, and so I didn't even know that they had different associations for the different groups. So I was just curious as to what they were and how they function.
So Corinne, was your dad, is he or was he a member of any type of organization?
I've been meaning to ask him. I haven't talked to him since I started this presentation, but I'd be curious to know.
Yeah, I'd be curious too. You have to let me know what he says.
Yeah.
Okay, so after researching and reading up on it, are any of you more or less likely to join an organization yourself? I know a lot of students are either in healthcare administration or public health, and there's organizations with either one. Would you be more or less likely to join an organization based off what your major is?
I think I would be more willing to join. I chose this topic kind of because I was interested in the specifics of the healthcare administration organizations and how they help with someone that's in that field. And so I think in researching these, they help a lot if you're, for one reason, if you're interested in improving your status as a healthcare administrator. And I think that that would be very helpful to me if I was to want to improve in my status.
Very good. So you mentioned that you're interested in it because of the healthcare administration side. Is there a particular organization that if you were to sign up for that you would actually do, or not sure about that yet?
I don't know. The two that we have in our presentation, I mean, I don't know that much about them to make a final decision, I guess I should say. Like, obviously, I would need to do a lot more in-depth research about them, but from what I understand, they both sound all right. I mean, I don't know.
Sure. Okay, let's go one more question here. Let's say you are working within a healthcare administration capacity. What would be the biggest disadvantage to being a part of an organization? In other words, why wouldn't you want to be a part of an organization? That's kind of what you talked about.
I don't see any disadvantages except for the fact that you have to pay your dues like every year, I think, and some of them can be a little expensive. But other than that, I think they help you a lot in getting more up to date and getting tools that you need to succeed in your role, in your career.
I think that's a great answer. That's kind of what I was looking for. Is cost is the one thing, and the other thing that would be is there's no way that being a part of this organization or any of these organizations would be a disadvantage other than the cost. It just kind of comes down to a question of, is it worth your while? Is it worth the cost? Is it worth the fees or not? But very well done, all four of you, all five of you who are part of the group and everything. So great job. Anything any of you want to add before I let you enjoy the rest of the night?
No.
Okay.
I think so.
Well, thanks for hanging out with me. You all did a really great job, and enjoy your Sunday tomorrow.
Thanks, you too.
All right.
Have a good night.
Yeah. Bye.
Bye.
Bye.